Thanks for listening to the Pharmacy Podcast Network.
Good morning, everybody. It's Shane, the accidental pharmacist. So I have a few minutes before work starts, and I thought it was important to jump on here and do a video and talk about the events of yesterday. So initially, when I heard that Charlie Kirk had got shot at an event in Utah, I put up a link to the story, and my comment was that I can fundamentally disagree with you on everything political or otherwise. You can have a vastly different worldview on every topic from me, but I would never wish this kind of violence on anyone. And I stand by that. Regardless of who the individual is, no one deserves that. And I sent my prayers out to his family and his children who no longer have a father. And as a father of 5 myself, I can't imagine a world where I wouldn't be able to grow up with my children. And that is me displaying empathy. And I know everyone out there is going to say, well, Charlie Kirk had some unusual thoughts about empathy. And I'm paraphrasing here, but he said something like, I hate the word empathy. I think it's a made up new age term that does a lot of damage. And this is something where we fundamentally disagree. I think that empathy reminds us that all of us are connected in a way that is bigger than any of our differences. So I wanted to say that. And the second post I put up was because I saw the dumpster fire in the comments saying that I want to be very clear that if you follow the page and you're celebrating right now, you and I are different, and you should take it upon yourself to unfollow. But here's where some people got mad. I've lost a couple followers in the last day, maybe 100. But what I meant to say there was, I think that we disagree. So don't think that I share this view of the world with you. Some people started sending me direct messages telling me I should be taking down posts of comments that people are making. And here's the thing. If you believe in the First Amendment and you believe in freedom of speech, people are allowed to be as garbage of a human as they want to. I mean, I think we see that in the worlds of politics on both sides all the time. People can say some terrible shit and be terrible human beings. And I think it's upon them to be able to decide, maybe I shouldn't have said that, and take it down themselves. I have never blocked anyone from the Accidental Pharmacist page, and I've never deleted a post, even when it's been terrible, even when it's been about me. One time I made a joke, a lighthearted joke about diabetes, and this woman went on a rampage on me. She went to my personal page and made statements about my children that she hopes that they get diabetes and cut off their legs and stuff. And I still didn't do that because I think you have to police yourself. And I'm sorry if you want me to take down posts that are shitty. I'm not going to do that. That's really what I have to say about this. The last thing I'm going to say is I know politics divides us, and I feel like politics divides us in this country in a way that it never has, even in the past. And I consider myself pretty liberal, but I'll admit that the far left and the far right, the people who are super radical and would cheer if someone like Charlie Kirk dies, or cheer if someone like Nancy Pelosi or AOC died. Those are the people that choose to divide us. Those are the people that I really worry about. Everyone else, I want to hear your opinions. I want conservatives on the Accidental Pharmacist page. And I know people don't like the fact that a pharmacy page talks about that. But it's also a page where I talk about anything that's bothering me for the day. I try to make people laugh. I try to make people think. I try to make people angry sometimes. You know, that's what a page is supposed to be. It's your inner thoughts, and it's a way of screaming into the void to eventually a few 100,000 people. So I'm willing to listen to any of you. I'm sorry if you think I handled it poorly, but that's just who I am. I do want to say one more time that I don't condone violence in any way. My God and my heart would never let me. And I pray for anyone who's suffering today because of the loss of Charlie Kirk. Have a great day. I'm going to go to work now and Pharmacy On.
Feeling lost with the complexities of pharmacy accounting?
In pharmacy today, there's so many different, variables and issues that impact the pharmacy books, records, accounting, the profitability of the store, so forth. There's different components of pharmacy that have its own nuances from an accounting standpoint. And so it's tricky. There's no doubt about it.
Ready to take your pharmacy to the next level but don't know where to start? Sykes & Company is here to help. Introducing the RX Assessment. With the RX Assessment, the pharmacy CPAs and advisors at Sykes will do a deep dive into your accounting and tax situation and give you the action steps you need to take your pharmacy to the next level.
If you're interested in, working with a team who understands the industry and how the accounting and tax should really be in a pharmacy, this is your chance to get a under the hood check of what's going on and getting the feedback of any issues or concerns or, again, things we think you're doing really well with.
Get the financial checkup your pharmacy needs and head over to sykes-cpa.com or call 252-482-7644.
Hey, special segment on This Week in Pharmacy. I want to welcome Rob DeWig with Inmar Intelligence. Rob, I've been looking forward to this conversation because I have to tell you, I have a curiosity about this platform. So thanks for being on TWIRx.
Yeah, appreciate you having me, Todd. And I've been looking forward to this as well.
All right, right out of the gate, Inmar Intelligence Systems, give our listeners a kind of the mothership overview, and then we're going to dig specifically into specialty as well as revenue cycle management. But start off with that mothership's positioning. Who is and what is Inmar Intelligence?
Yeah, I often tell people that we are the largest healthcare company out there that a lot of people haven't heard about because we do a lot of things behind the scenes. We're based in Winston-Salem. Two divisions. We have a healthcare division as well as a MarTech division, which focuses on digital marketing. But I've been working in the healthcare division for about 18 years. And kind of what we're best known for is our reverse distribution. So taking care of unsaleable returns for issuing those back through the process for credits back to the pharmacy. And that's kind of where we got our start about 25 years ago in that business. And we have a huge presence in hospital, retail, chains, independent pharmacies, as well as pharma manufacturers. But over the past 10 years or so, we've really grown what we call our workflow solutions, our pharmacy financial management solutions, as well as compliance solutions. So more data solutions that we can help pharmacies spend more time with patients and less time on the operational issues that bog down what really they went to school for in the first place.
We are really excited, Rob, about the coming of the NASP, the National Association of Specialty Pharmacies. You're going to have some team members there, so we definitely want them to stop by the NASP booth to talk about, hey, how does revenue cycle management impact maybe the specialty provider specifically? And before we started recording, you were the one to make the point, the expense of a mistake or the expense to an operations in the realm of specialty pharmacy is pretty sharp. I mean, that one medication could really knock you off if something isn't coming in from the reimbursements. And something I didn't know about Inmar Intelligence is the amount. It's staggering. The 25% of all of the prescriptions that are out there are coming through Inmar Intelligence. I never knew that. I have to even admit it myself.
Yeah. We started in the retail chain space, and then we moved on to outpatient pharmacies and health systems, specialty, long-term care. So we kind of touch a lot of those different areas for reconciliation claims. And you hit it right on the head, Todd. It's one thing if the blood pressure medication, if you're not getting fully reimbursed for that lisinopril, But another thing, if there's a specialty drug that you're not recouping what you should be getting paid back on, and we give the insights into that and identify areas where we can either take action on your behalf, or you can take action. The pharmacy can take action to follow up, because there's, pharmacy world is complicated, right? And with all the different people that are involved in making sure that claim is processed, we give those insights in direction on how to handle those properly.
Do you see, Rob, a change of where specialty is growing in comparison to where it was 10, 15 years ago? And unfortunately, we're the veterans now that we can say, hey, 20 years ago, I remember. And that's kind of eye-opening in and of itself. But talk to me about the sectors. When I think of sectors, I'm thinking of our health system, hospital system, pharmacies saying, hey, we have enough of a patient base, we have enough of an expertise in some kind of cancer that our patients are experiencing. Therefore, let's build a specialty pharmacy to assist our entire health system. That's growing. I mean, that's happening. Right. So talk to us about where Inmar Intelligence fits into this.
Yeah, and that's what our customers have been telling us for a while. It's, with health systems, the inpatient pharmacy is not the moneymaker, right? So how do they find ways to bring in revenue into that health system? And that's where we've seen a lot of that specialty growth. And you could say that across the board. And so, we have current solutions that, of course, there's going to be some unsaleable returns that we can process for credits. We can make sure that those claims that are being processed are processed correctly and reimbursed correctly. But also specialty pharmacy, that fun DSCSA that is going to be enforced here very shortly. We have solutions around that, as well as identifying if anything's recalled, and numerous other solutions. But that's also where our product roadmap is heading, is to increase operational efficiencies, once again, so people can spend more time with patients. And when you're talking specialty, you're talking high dollar items, as opposed to a lot of the stuff that you're going to find in a traditional retail setting.
Yeah, the discussions around specialties evolution is a buzz, and I'm sure we're going to be hearing that at NASP 2025 in Denver. Something else that is buzz is holistic pharmacy and the data that's needed to measure that against the combination of pharmaceuticals and holistic medicine, or food as medicine. The Progressive Grocer and Inmar Intelligence have partnered again on some awards that really bring some grant money to superstars in the grocer section. That commitment, Rob, tells me a lot about the insights of Inmar Intelligence. It's not just about pharmaceutical realm, but it's about a bigger idea. But share some of our listeners who might not even know what you guys are involved in. Yeah,
and so we once again, we sit at an interesting point in healthcare because of our relationship with different grocers that have pharmacies in there, and how can we bring the worlds together? And I know a lot of those big retailers have been looking for ways of doing that for some time. We continue to have discussions on what our role can be in there with the different insights, and how can food is medicine, or food is health, which I think is the new trending term that the industry is adjusting to. How can we bring those worlds together to help people get off meds if they can, and eat better and healthier? So, absolutely.
Yeah, the preventative medicine is better than having to take the medicine in the first place. So you have to. I'm getting up in age, so I'm starting to pay a lot more attention to protein intake and vegetables, and really dialing in. And I think the earlier you can get into that habit, the better.
I know. I was always envious of those people that embraced it in their 20s, when I was a late bloomer in that area as well. But I think the growth of GLP-1s has opened people's eyes to the combination of food is health and medicines and how they work together, because people getting on a GLP-1s doesn't solve everything. There's a certain diet around it, one that'll help you with those medications, but also to live a different way and different lifestyle afterwards.
Where do you see use your imagination? It doesn't have to be what is today, but I think of my local grocer here in the Pittsburgh area, Giant Eagle, and they have the Giant Eagle Advantage card. So I imagine, well, we have the data. So if I check out and I'm buying lettuce and spinach and fresh green beans and like produce, and I have this other supplement I bought, and I get a cereal that they know the data on the cereal, and therefore if it has brand, what would happen if I had this point system that would encourage my family's buying per se, to tie back to a health plan or tie back to coupons for co-pays at my pharmacy? But what does your imagination tell you with the advent of AI and the touch that Inmar has to the literal consumer that's purchasing product? I mean, that's some powerful stuff.
Right. Yeah, I think you hit it. You hit part of my imagination right in the head there, Todd. And tying in, it's always been tricky around PHI, and tying in the front end with the pharmacy. But I think, from a health plan standpoint and being able to track outcomes from the, call it encouragement of eating healthy, and what are the effects there? We looked internally at GLP-1 usage, and it's not just necessarily the weight loss, but it's what other medications were you able to get off of. I don't want to make this all focus on GLP-1s because I know there's a own set of issues there, but I think the data around it is really interesting to think about how we can think about medications and lifestyle choices combined. And if you want me to put my magic wand or my imagination cap on, I think that's getting payers involved and tracking outcomes. That's when you're going to see some really difference in the world. Yeah,
absolutely. This has been good. I've been looking forward to understanding more about Inmar Intelligence, someone that has been out there for years and understanding, connecting our facilities, our hospital systems, and now, of course, our community and retail pharmacies with more data and being able to leverage that. And that's special. Very much appreciate you talking with us today on TWIRx. Rob, I appreciate it.
Thank you, Todd. And we will look forward to seeing you at NASP, and make sure we stop by the booth. And if anybody's interested, they can try to run into us out there as well.
Absolutely. Look for the Inmar team. If they're floating around, look for the badge, the INMAR. It'll stick out, and grab them. Say, hey, I heard a podcast about you guys.
That's right.
All right.
Yes. Thank you, Todd.
Thank you. Hey.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
Hey, Shrilik is back on This Week in Pharmacy. You're becoming a regular on this show. How have you been?
Good. I don't know if it's good or bad, but like people will miss seeing me every Friday. Anyway, it's great to be back.
It should just be the Shrilik Friday show, and we can like.
I don't know that I have enough materials for that.
All right. Well, the reason why you're back is because of the timing of this all, and we've been conference heavy We've been to all three of the wholesalers conferences. We've really dialed into community pharmacy over at the Independent Pharmacy Cooperative Group over at IdeaShare. It was wonderful. And then we went to the NACDS, the largest show for our chain pharmacies, and how chain pharmacies really, more than ever, it's needed because of the demise of many of our pharmacies throughout the nation. The chains that are there through grocery stores and through some of the regionals, they're becoming strengthened by doing other things than just dispensing medications, but they're also doing immunization programs, and they're dialing into disease state management. And so this is exciting that you got to come back, because we're getting ready for the NASP, the National Association of Specialty Pharmacy. A shout out to Sheila Arquette and her team. It's going to be in Denver, Colorado, September 14th. So if you're listening to us today and you're going to be around, come see us at the NASP. But Shirley, talk to us about why you're excited about this event and how you're tying into specialty pharmacy.
I think, first of all, it's a great opportunity to see so many leaders coming into Denver, like in a couple of days. And just in general, like some of those conferences are an opportunity for us to meet our partners, our customers, and like people that we've been like in touch for years, and just get a pulse check on how things are going. But I'm even more excited this time around because we'll be moderating a very exciting panel on Sunday morning around how specialty pharmacies are tackling their kind of affordability challenges for them and for their patients, and how can technology help them do that in scale. And what's exciting about it is, I think, first of all, it's a challenge that all specialty pharmacies, and I would say even more so, all pharmacies share. But we've been able to put together a group that will be moderating a panel with from different types of pharmacies that are seeing very different patient populations, are deploying technology in different ways, and to be able to share that in also the educational track of NASP this coming week will also be very helpful for others who will like learn how to apply those learnings into their own day-to-day work. So pretty excited to head out to Denver.
Yeah, this is September 14th. You're going to be doing the impact of technology on specialty pharmacy affordability programs. That's exciting. And I kind of wanted to go back to a previous conversation that you and I have had, I think at Assembia, and that is, let's talk about the unique challenges that specialty pharmacies have experienced in terms of technology specifically.
Listen, I think they've been awesome about what they're doing. But the scale that they are like dealing with in terms of how many patients are now on specialty meds, and how they need to like make sure that they are scaling in an efficient way, and also adapting to the new norms in both patient engagement, use of AI, and then driving results that will matter for the pharmacy with never-ending pressures. I think it's just creating a ton of challenges across a multitude of like areas where technology can be both, you know, a solution, but also you need to figure out how you make that solution work for you and not vice versa. And one of the things that we will be talking about is that when you are deciding to tackle a specific kind of operational challenge or a business problem, and you want to do that with technology, and you go through the process of like identifying your own needs, and then you go out and look for partners that can support those needs with technology. I think when you find your vendor or when you find your solution, sometimes as a pharmacy, you are saying, okay, now I can relax. And it's actually the other way around. Now the journey starts. And when you think about the challenges that those pharmacies have, it's not solved when you choose your solution. It starts because you need to make sure that whatever you chose is actually translated into an adopted, well-deployed solution that your end users, pharmacy technicians, patient care coordinators, and so forth, would like to use. And then you'll be able to see the bottom-up adoption leading to results. And I think that's a pretty challenging task to do. Definitely if you're a large specialty pharmacy, definitely if you have all of the other kind of challenges around you that I've described at the beginning.
I want to go back. You said about technology, and we're talking about accessibility. How do you think technology has impacted. Like, for example, TailorMed, making it more accessible, maybe making specialty pharmacy and making specialty pharmacy services more accessible to our patients, including being able to get those medications paid for.
So what we focus on is becoming kind of the backbone affordability partner to the pharmacies that we work with. To get to a point where a prescription comes in, we automatically identify if the patient has an out-of-pocket cost that they need assistance with. Is there a program that can help with that is like financial barrier? And then lower the burden and like streamline the process of enrolling and capturing those financial assistance dollars that will help the patient get on therapy, stay on therapy, and reduce the financial burden and the potential abandonment for the specialty pharmacy. And when done right, what we're seeing is an increase of utilization of third-party assistance. We're seeing a reduction of time to enroll, cost to dispense, turnaround time of script in to shipment of a prescription, and also a better patient experience, because those patients, for the most part, will be dealing with conditions that are challenging enough clinically. If you can alleviate that financial concern, we actually heard from field reps of our specialty pharmacies, this is becoming the biggest selling point and differentiator of the specialty pharmacy to provider offices.
So I'm excited about what you're doing, because you're accelerating and assuring that they're going to start the medications, they're going to stay on the medications, is helping in adherence, especially some of these very serious diseases, expensive diseases, to start them off, and then all of a sudden 3 months in, they're not able to afford their medication anymore. You're really putting technology in place to help that to happen less, if not ever. And I'll bet you any money that artificial intelligence has kind of played a role of that. That's all we're hearing through the news cycles. Every time we turn around, there's aspects of it that I absolutely love. The organization of the systems, the querying, the research, accessibility. I still think that the pharmacist needs to be in control of being able to set and push disease state management, but using AI is just wonderful. What advice are you going to give to providers of specialty pharmacies regarding AI? What do you think? Where are we at with all this? And what can we leverage? And what are some of the things that you've noticed?
So listen, I think that the word AI is thrown around a lot.
Yeah.
I think there is a lot of noise, but I think over the last year, we've seen that there is true value that can actually rise above the noise and really make an impact on those specialty pharmacies and their patients. For us at TailorMed, we look at what AI means under the hood and above the hood, if there is a term like that. Under the hood, we are able to innovate so much faster with the use of AI for our own teams. We're able to bring that into the user's hands as well when you think about different types of solutions that will allow us to track changes to programs automatically much more faster. We can navigate the maze of thousands of different assistance programs instead of like with searching with a chatbot, and we have deployed that as well. I think one of the more exciting things that we've seen in the adoption of AI and in general, the progress or the evolution that we've seen with specialty pharmacies. When we started working with specialty pharmacies a few years ago, we were displacing a manual process. And we were bringing in something that will connect our system with a bidirectional integration to the pharmacy system. And that was a huge leap forward. You then add AI on top of that, you can see efficiency gains and you can see product adoption gains that are substantial. But one of the things that we've seen in addition to that is when the adoption happens and where you are truly becoming the backbone affordability partner of the pharmacy, the next step of the evolution is actually engagement directly with patients. And we are now seeing our patient-facing solutions deployed across our specialty pharmacy network that's allowing patients to be even more involved and potentially fully self-serve and manage all of those copay assistance options in a virtual copay wallet that we are deploying for them. And you wouldn't be surprised that a ton behind that is powered by AI.
Love it. Well, I'm looking forward to seeing you in Denver at the NASP 2025, Shirlik. Looking forward to getting you on the post show and bringing a colleague or a friend or whomever else you think's going to be there. But safe travels to Denver, my friend.
You too, and looking forward to seeing everybody there. It's great content and a great conference. Looking forward to it.
Hey, to learn more about TailorMed, go to tailormed.co. Once again, that's tailormed.co. We'll see you in Denver.
In long-term care pharmacy, decisions can't wait, but disconnecting systems and static reports can slow you down. SoftWriters is introducing a new way to manage your data with Framework Insight. Framework Insight is an AI-powered business intelligence platform built for LTC pharmacies using Framework LTC to manage day-to-day pharmacy operations. With intuitive dashboards, you can track key metrics like prescriptions filled, drug costs, inventory trends, claims, and profitability. Drill down, set alerts, and save custom views so you're always a step ahead with at-a-glance and on-demand visualizations into your pharmacy's most essential metrics. Framework Insight syncs your data daily, giving you instant visibility into both daily operations and comparing current trends to historic performance benchmarks. Turn data into decisions and decisions into progress. To see it in action today, visit frameworkltc.com/framework insight.